Welcome to the WITS Donald Gordon Radiation Oncology Unit. Our core purpose is to enhance the quality of life of our patients by providing comprehensive, high-quality treatment whilst also focusing on their physical and emotional needs. Our team of medical professionals is dedicated to delivering the best possible clinical outcomes in a warm, friendly and family-focused environment. In this video, we will cover the following topics. What is respiratory gating? The deep inspiration breath hold technique, the CT planning scan, treatment planning, and what to expect during treatment. As our patient, all you need to do is lie still in the treatment position and breathe using the techniques we will teach you in this video and leave the rest up to us. Respiratory gating is a highly specialized radiation therapy technique used to treat tumors that move whilst natural breathing is occurring. In radiation therapy, a very precisely targeted radiation beam is aimed at the tumor. The goal is to kill the cancerous cells while sparing the surrounding normal tissue. This becomes complicated when treating tumors of the breast, chest, and upper abdomen, which move as one breathes. The respiratory gating system allows us to track a patient's breathing pattern externally, whilst doing a series of internal scans. This allows us to pinpoint the exact location of a patient's tumor during their breathing cycle. We can use this data to program the machine to only turn the treatment beam on when the tumor is in the exact same location during every breath. The deep inspiration breath hold technique facilitates the treatment of lungs, liver, pancreas, and can minimize the dose to the heart in selected breast treatments. During this technique, a patient is treated only whilst holding their breath in. Using an infrared tracking camera and a reflective marker block, the system is able to measure a patient's breathing and display it as a waveform. The threshold of this wave is then set at the highest point or when the patient has taken in as much air as possible. This is then used as the reference for their treatment. Before the radiation therapy treatment, a computed tomography or CT scan is initially performed. The CT scan provides extremely accurate data which is used during the radiation therapy planning process. During the CT, the depth of breathing is checked with a marker block which is placed on your chest or upper abdomen. The infrared camera then records the movement of the block as you breathe. Prior to performing the actual CT scan, you will be asked to practice the breathing technique. When the correct rhythm is found, the planning CT is made. Throughout this procedure, you will receive voice instructions via an intercom. The scan procedure takes approximately 30 minutes, and at the end of the procedure, semi-permanent tattoos are made on your skin with a needle and ink as references for your daily treatment. The CT data obtained at the scanner is then digitally sent to the planning department at the Radiation Oncology Unit, where your radiation oncologist will define the area to be treated. The radiation therapist then plans the radiation around the area defined, whilst sparing as much surrounding normal tissue as possible. Once the planning is complete, the calculation and assessment of the radiation dose received by the area being treated is checked by our medical physicist, where the plan must pass all the required quality assurance tests. Once this is done, the treatment can then commence. The radiation therapy treatment is delivered by a team of radiation therapists, and the treatment will occur in exactly the same position as you were in at the CT scan. Voice prompts will be given to you throughout the treatment, and goggles will be used to provide you with visual aids so that you are aware of where your breathing pattern needs to be for the radiation beam to be switched on or not. It is important to note that the machine is programmed to treat only when the desired location of the breathing cycle is reached. If the breathing is not at the desired level, the beam will automatically switch off. Thus, it is important to remember that you should only hold your breath as long as you can, as the machine is programmed to do the rest. You can watch this video again and practice your deep inspiration breath hold by following the tips in the brochure provided. If you have questions, we are here to help you. Thank you for choosing the WITS Donald Gordon Radiation Oncology Unit as your treatment facility. We look forward to taking care of you.